Hello, and welcome to another edition of To High School and Beyond. I'm Jean Turner, your Career Development Coordinator from Hickory High School, and
And I'm Josh Cornwell, the Career Development Coordinator for both middle schools. And we have two special guests with us today, Ms. Kelly Yang and Angela Cheek. I will let you two introduce yourselves. When you do, just tell us a little bit about yourself and what you do for a living.
Hey guys, my name is Kelly Yang, and I'm the director for the Orthopedic Surgical and Medical Unit at Catawba Valley Medical Center, and I'm a registered nurse.
Hi, I'm Angela Cheek. I'm the nurse manager for Heart and Vascular. I supervise nurses. I work with an interdisciplinary group of RTs, CVTs, radiology, cardiology, vascular surgeons, and we do a lot of diagnostic and treatment for patients that come to our hospital.
wow, you guys have a lot of responsibility. And we are glad you are here with us. We noticed that you are still in uniform and you're in mask. So you are showing us how healthcare really is operating these days. So tell us, how did you know that you wanted to pursue a career in healthcare?
I had a procedure when I was a child, about 7 years old, and I was just really impressed with the nursing and the physicians that I met and just the different people in the hospital. And I was like, you know what, I want to do that. I want to help people out when they're sick and scared and just make their visit as comfortable as possible.
Okay, all right.
And for me, it was kind of like Angela. It was whenever I was younger, and I was brought to the hospital, and my grandfather was very sick. And what inspired me to go back into nursing was because he was sick in the hospital, but there wasn't anybody in the hospital that can actually help him translate. And I thought, you know what, this is a great opportunity for me to go back and give back to my community and be a registered nurse so I can actually help translate and support the community, just not just our community, but the Hmong community for myself as well.
Oh, that's awesome. Totally understand that.
So, what are your typical job duties like on any given day?
For me, what I usually do when I come in, I make sure that I check all my units, the ortho surgical medical unit, make sure staffing's okay. And then we coordinate with a lot of our leadership to make sure that our staff is safe, the patient is safe, following policy and procedures. And of course, this good old COVID has threw all of us in the ranch. But that's one of the main things is keeping everybody safe.
And when I come in the mornings, I make sure that there's nurses, techs, staff are doing procedures. I make sure that our first patients have arrived for the day because your goal is to get the first patient started on time. I make sure that we've got supplies for patients. I make sure that we've got vendors. We've got people that bring supplies for patients, and I just try to make sure that all the pieces of the puzzle fit that day so that we can give timely and excellent patient care.
Okay, thank you, ladies. So you've been in this field for quite some time, right?
Correct. I've been a nurse for 18 years.
I've been a
Okay,
nurse for 26 years.
okay. And this video does go out to our middle school and our high school students. What would you tell them that you think are the most important skills that they should have to enter into healthcare?
I would say to enter into healthcare, you've got to be compassionate, you've got to be able to communicate, and to be probably non judgmental. We deal with a lot of different patients from all walks of life, and we want to make sure that we take care of patients culturally, all the different cultures and races. So I would definitely recommend communication skills.
Absolutely. And then I want to add a little bit to that as well. I believe that being positive as well, because if you come in with a positive attitude and leave with a positive attitude, your day is going to be so much better.
And I want to add that they need to make sure they take science courses, math, those type of courses will prep you for the college work that's ahead.
That segues perfectly into my next question. I was going to ask, what kind of education do students need to be looking toward if they want to get into a position similar to yours?
I started off at the community college. I went to Western Piedmont Community College and got my 2 year degree there. And then after that, I went from the West Coast to the East Coast. I got my bachelor's at Western Carolina, and then my master's at ECU.
I
Okay.
would recommend that the students take any kind of health courses that they can. That'll expose them to healthcare careers, blood pressures, different things that we do in healthcare. They need to take college prep classes. I needed to work and go to school at the same time, so I went to community college. I got my associate degree in nursing, which allowed me to enter the workforce. And as working, I went back online to get my bachelor's, and then last year I completed my master's degree. So I did it in steps, and I attained my goal. And that's just one of the ways you can do it. Some students go straight to get their BS in and then their master's degree.
But my biggest recommendation is for especially high school students to, if they are really serious about going to nursing school, I want them to take a CNA class. A CNA class to get them ready to know exactly what they're in for and try to get a job, a part-time job as a CNA to see if that's really what they want to go into. So my biggest advice is to go to get a CNA job first. And I will tell
Yeah.
you, my best nurses are CNAs.
Awesome. And we're very fortunate in Hickory Public Schools that we actually offer that program here. And it's probably one of our fastest growing programs is our health science program. And for the last, I want to say 2 or 3 years, don't count me on it, our students have had 100% proficiency passing that CNA when they finish the course. So we've been very proud of our students going through that program.
And before we go too much farther, I know what a CNA is, but for our students, what does that acronym stand for?
The CNA, it stands for a certified nursing assistant. And what they do is really they're the right hand man to the nurses. And they help with baths, they help with lunch trays, they help walk patients. They really see the patients firsthand, and they're the one that spends a lot of time with their patients doing that compassionate care.
Gotcha. Thank you for that explanation. So you talk about some of your different duties. What are some of the things that you enjoy most about your job? Then what are some of those areas if you didn't have to do what maybe you would maybe give it to somebody else?
What I like most about my job is meeting patients. Every patient has an individual story, and you're actually given an opportunity to learn about them, to bond with them, and to hopefully make a difference for them in their lifetimes with the short interaction. And some patients you bond with them because they come multiple times if they have chronic or long-term illnesses. What I like least about my job is probably the documentation. There's a lot of documentation that has to be done, and that's where those communication skills come into help.
I would totally agree with Angela. It's meeting the patients individually because they do have different stories that they can tell us. But Angela said it perfectly.
I don't think I met anyone in healthcare that wouldn't disagree with you. We've come so far with technology, but there is still a lot of documentation, a lot of paperwork that has to be done. So we appreciate what you do.
What kind of hurdles or challenges did you have to overcome in order to get into the positions you're in today?
I think it's individualized because a lot of people come from different aspects of life. Some of them go straight into nursing from high school, and then some of them are this is their second career, and then some of them it's because they were laid off of work or coming in. So I think it's just a different aspect. My hurdle when I went into nursing school was that I had to work a full-time job and go to nursing school. So that was the hard thing was to find time to actually study and go to school at the same time full time.
Excuse me, some of the hurdles that I encountered, it was competitive to get into nursing. So I had to wait a year. I used that time to take some of the required courses that you could take that were outside of the nursing curriculum. In addition to being very competitive, you have to make sure that you have those math and science classes, and a lot of those classes can be taken at the community college, which helps people that need to work along with going to school.
So a lot of our students, you ask them what it is they want to get into, and they'll say healthcare. Well, why do you want to get in healthcare? Oh, because I've watched Grey's Anatomy or I've watched some other hospital show. Ladies, can you dispel any of those myths that students might have from what they see on TV to what it is in real life?
I'd like
Okay.
to just some of the real challenges to healthcare now is there's jobs availability, but we're dealing with pandemics. I think pandemics and viruses are going to be a thing that's going to continue, and we're just going to have to learn and grow how to handle it, just like we did the HIV epidemic long time ago. But we, bond as a team. We get community support, and I think for the most part, we're all still very glad that the career choice we chose.
And to add to Angela, sometimes these patients are coming in sicker and sicker and sicker, and it's getting harder and harder on the nurses. And like the TV shows, there's usually happy endings, and sometimes it's really hard. There's not a happy ending sometimes. And as nurses, we have to go through that because we have to face that with our patients, with our families as well.
Thank you for sharing that.
Yeah, I can see that being challenging. As we start to wrap up here, do you have any closing advice for students who might want to do what you do when they grow up?
My advice to students is we're nurses, but there are a lot of different career paths and choices in the hospital. We've got people that help you speak again after a stroke, speech pathologists, they teach them how to swallow and eat again. We've got physical therapists that get you up and walking, pharmacists that dispense meds. So it takes a team, and that's just a few.
Respiratory therapy.
Yeah.
So we've got so many people working as a team, as a disciplinary team, to make sure that the patients get what they need so they can actually go home. And nursing is a great, great career to go into, but there's other opportunities out there in the organization. And if there's any questions, they can always reach out to our organizational learning, who the director is Rose Cook, and she can definitely point them in the right career path or pair them up with somebody that can actually come in and they can do observations if they want to.
And the best part, you usually make enough money to pay your bills and to have fun as well.
Definitely. Well, I'm glad you brought up Miss Cook's name because we have partnered with you guys for years, whether we are connecting students to the volunteer program, to the summer camp med program. Kelly, that's where you and I first met.
Correct.
And then, of course, Angela has sponsored quite a few of my interns. So we thank you for not only what you do in the hospital for the patients, but how, as a hospital, you are always giving back to students. So we definitely appreciate that.
You're welcome. And we love students. I mean, that's where our workforce come from, is from students. And I can tell you that, a lot of the students that do come and experience Catawba, they come work for us at Catawba. And we want to foster that home, like they're coming home to work with us.
I think it's an honor, it's a privilege to work with students, and we admire teachers so much because you're the backbone of everything. So we had teachers as well in nursing school. So we just want to thank you, and it's an honor
to work with you guys.
Thank you. It's definitely an honor to have y'all here with us today. And we're so grateful that you came on and interviewed with us today so we could share your insight and your experience with our students.
Thank you so much. I meant to ask you guys about like your shifts, like your daily shifts and what you do, like how many hours per day, what does your work schedule kind of look like?
Well, for my shift, my typical shift is Monday through Friday, 8 to 5. But then, of course, being part of leadership, I am on call, and I also take call on the weekends. So it just depends on how staffing looks, that I might have to come in on the weekends and work sometimes.
The majority of nurses, I think, work 12-hour shifts. And in leadership, like Kelly was saying, work 5, 8 hours. And then I like you to let the students know too, there's traveling jobs, the opportunities are endless. We've got nurses in all types of backgrounds, from schools to sports clinics to telephone calls, hospital, nursing home settings. They're doing informatics. They're working with computers now. So it's a lot of different opportunities available.
Correct. It's not just limited to the hospital setting. There's an array of nursing jobs out there, to pediatric nursing, to home health. So there's a lot of different jobs out there.
Have either of you guys worked in a different setting other than the hospital?
I have. I've worked, actually, I went to go teach at Western Piedmont as the simulator coordinator for about 4 years, and then I came back to the hospital.
Oh, okay.
My preference. I like the acuity of the patient.
I like the fact that, Kelly, you said that you came back because you wanted to fill a need that you didn't think was being filled
Matt.
there because of the language barriers. And I try to tell our students all the time, if you are bilingual, definitely share that, because that is a plus in your hat. Some of our students, that might not be their first language, and they may learn another language, so then they're fluent in another language. Capitalize on that, because that does help. I know that that's something that's important in the hospital, because my interns have even said that before too.
Correct. And it's so important. It's so important that, we try to close that gap with barriers, because we have to. We really have to.
And
Right.
just to note on that, we're trying to, get more diverse people, including men, into the healthcare industry. So that's kind of a goal that we've set, is to diversify the healthcare field.
Correct.
Well, I think you guys are doing a good job at that. So again, thank you. We won't take up too much more of your time today.
Thank you guys. We had fun today.